Self. Here you go.
Good morning, everyone. Thank you for joining us for today's webinar about the MIOSHA emergency rules that were released last week. We are very blessed to have the Deputy Director and Director of COVID-19 Workplace Safety from the Department of Labor and Economic Opportunity, Sean Egan, with us this morning. Let me do a quick reminder that if you have questions during the webinar, please feel free to type them in the question and answer box, and when we get to that portion of the webinar for questions and answers, I'll be sharing those with Sean, and we'll try to get you the best answers that we have available. Let me tell you a little bit about Sean as well. He is a lifelong Michigander, big plus there. He is a Navy veteran, another big plus. Go Navy, beat Army. He became a journeyman electrician and is a former shop steward and president of a local IBEW in West Michigan. Back in 2010, he was named as one of the 40 under 40s in Grand Rapids by the Grand Rapids Business Journal, which is an excellent title to hold. He holds a Bachelor's of Business Administration, and he's got a JD from Cooley Law School. Has 3 children and his wife, Christy. And I'm very happy to welcome to the MMA membership, and for today's webinar, Leo Deputy Director, Sean Egan. Thanks for joining us, Sean.
Thanks so much for having me. I know it's been quite some time since we've talked. Great to see you again, Dave. Dave and I talk quite frequently, but to the members, it's been quite a while since I've been on, and part of that is because most of you have been open the whole time. Many of you were critical or essential industries and just kind of kept on trucking through the stay home, stay safe order. And then many of you came back online. I can tell you that Dave and Mike are great about sharing information. We do hear and understand some of the issues that you're facing, not only as it comes to workplace safety, but some of those talent issues, supply chain issues, and other things that you're really trying to fight through as we continue to battle COVID in our state and across the country, and frankly, the world. We know it's hard. We know it's challenging, but we're going to keep on moving forward. So today I'm going to share some slides for a little bit, and then we will get into a Q&A for sure, like we always do. So let me just quickly share my screen here, and it always puts the video right in front of your show presentation button. But as you know, if you've been joining us for our live Q&A sessions on different industries, or even our HVAC sessions that I'll mention at the end of this, our goal in the Department of Labor from the beginning has been to help businesses get open and stay open. And part of doing that is making sure that we are creating safe work environments so that we're not hopefully going to be a source of spread of COVID. Certainly when we're seeing numbers like we are, we have to battle it in several different ways. But I'll just talk through today on some of the changes you might see and some of the continuity that you should see from the change from the executive orders to the MIOSHA workplace emergency rules that were issued. So just to recap real quick, there's a lot of noise around COVID. I know every day I watch the news, probably too much, and I know all of you do too. And sometimes it's hard to keep track of what's really happening as we move forward. I think hopefully we're moving quickly towards a vaccine that'll be approved and for use. Obviously, that's going to take some time. So whether we like it or not, we're battling COVID for some time yet. And we need to stay diligent and stay engaged to make sure that we're doing everything we can to contain COVID in our communities. And even with all that noise, a few things that have remained exactly the same throughout this crisis are the need for social distancing, good hygiene, and wearing face coverings when we're not able to maintain that social distance. And we know that, you know, somewhere around 40%, maybe more, maybe a little less, of the spread of this virus is coming from asymptomatic people, meaning they're carrying and shedding the virus, but they feel fine and they're always going to feel fine. So really being able to capture those folks through good testing or otherwise is still a challenge. And that's why these face coverings are just so critical to make sure that we're helping to cut the spread. And some science tells us that that may cut transmission by 70 to 80% between people. And it really pulls that virus right back close to your face. So even that 6 feet or maybe even more, depending on the type of aerosols that we're creating, those face coverings really help bring it home and make sure that we're not potentially transmitting it to someone that's nearby. And we know as we go indoors, and in your workplaces, it's been all indoors, that depending on your ventilation and other things, humidity, you name it, the virus can hang around for a while too. And that's why the good hygiene and everything else is so critical. And the mask is that, you know, those aerosols are going to land somewhere. Those droplets are going to land somewhere. And we can contaminate ourselves by touching our eyes, nose, and mouth as well. So we really have to really focus in on those three key concepts. And when you think about the workplace rules, they're all designed around these concepts: maintaining that social distancing, wearing face coverings where you can't, and practicing good hygiene. So what we're tracking in Michigan, and all of this is available on the DHHS Michigan.gov coronavirus site, there are 71 ongoing workplace outbreaks. Now, when I look at workplace outbreaks, I take away schools, colleges, childcare, nursing homes, and jails, prisons, and detention centers. And I do that because those outbreaks are going to include a lot of non-employees. There's still a lot of employees getting COVID in those workplaces, but that's gonna kind of skew our numbers. So I really like to focus in on those places where we have a little bit more control and a little bit more direct data. So DHHS is continuing to track 71 ongoing workplace outbreaks, and in their data, that means that 2 or more people are linked from a single exposure event. So that's not, you know, Sean got COVID and didn't make it to work. That's Sean and Dave got COVID because they were close together in our network. And 18 of those are in the manufacturing and construction space. Now, I know that Mike Johnson had asked if there's a way to separate that data to make sure that we can better focus in on manufacturing versus construction. Unfortunately, I don't have that data, but I'm told that the majority of these are happening in the manufacturing space. And I think part of that is obvious, is that typically manufacturing will be a little more dense with the workers being closer together at times. And 6 of those ongoing outbreaks were from offices. Just last week, there were 31 new workplace outbreaks that were reported, 10 of those in office settings, 8 of those in manufacturing and construction. And just for reference, I know we focus a lot on social gatherings because that's where we're seeing a lot of outbreaks. 10 in offices, 8 manufacturing, 11 from social gatherings. So that doesn't indicate that workplaces are more risky, but what we're learning and we know is that any place we can congregate becomes a challenge when you're trying to fight COVID. And certainly work does that. And when we have increasing cases per million, we're in the D category for the state now because we're very high. And we have positivity rates well above 3%, which we were targeting at 4.7%. The likelihood of COVID making its way into the workplace is higher. So we have to be that much more diligent about what we're trying to do. So what MIOSHA has been seeing, I know there's been a lot of news about citations. I do like to remind everybody, MIOSHA has received about 4,000 complaints. We actually might be over that now. And we've seen news on about 35 citations. So that should tell you that MIOSHA is working really well with employers. Employers are working really hard to put forth that good faith effort. And where those citations have come out, I mean, it's really based on multiple factors that were going on there. And among those that we were seeing is the lack of a preparedness and response plan. Now, most of you have been open, so you probably have those. But if you don't, there's a great template on the website I'm going to mention. Making sure you're training employees on how COVID spreads, conducting those daily health screenings. Number one in the workplace is to eliminate the hazard. And if those health screenings are designed to help us do that. Not requiring facial coverings or maintaining that social distance where it was possible, and maybe not posting signs as required. I forgot the word required on there. So, you know, kind of a bunch of things kind of coming together. And if you look at those citations, many of those places had many of these things missing from their programs to try to contain COVID in the workplace. So we shifted to emergency rules last week. Now, I want to tell you from the beginning, MIOSHA's authority never came from the executive orders. MIOSHA had been using the general duty clause, I mentioned that last time I was on, which is set in statute, and the executive orders were essentially our reference document. When you use the general duty clause, MIOSHA will look to another source of authority. So that could be CDC, NIOSH, executive orders, DHHS, you know, whoever is creating a framework that employers should be paying attention to. So, but to create some consistency and clarity, we moved to emergency rules. Those were issued on the 14th and are in effect and in place now for the next 6 months under the emergency rule provisions. So we're going to be working with them there. And when we developed those within MIOSHA, we were really looking at those pieces that we believe need to be in place for the next 6 months and moving some of the stuff to DHHS. DHHS with epidemic orders can make changes more fluid. That's where the emergency orders were helpful because COVID is changing. More fluid and more routinely, when you set rules in place, they're going to be there for a while. So we really focused in on those things that just need to be there. Now, if you've been abiding by, in a good faith way, the executive orders, the guidance that we had already posted, these rules are pretty much consistent. There's a couple of key points in the manufacturing space that I'll bring out in a few of the questions that we've gotten in, but largely it's going to be the same: maintaining that social distance, wearing face coverings where you can't. Certain industries have to wear face coverings all the time. Manufacturing is not one of those if you can maintain the social distancing, except maybe some of your office space with in-person meetings and those other pieces. For the sake of time, I'm not going to click on the infographics, but we have a great infographic posted. It's going to include those daily health screenings and those other pieces that you've already been doing. And then don't forget to check out the DHHS epidemic orders. Those have a lot of the requirements for customers, for visitors, for contact tracing, for those other folks. We have some of that for employees and contractors in our rules, but for the general public at large, that's going to be more in those DHHS epidemic orders, as well as those capacity limits indoors. So a couple of notable updates we've been getting questions on. So temperature screenings in our rules moved to an if possible standard. From the beginning, manufacturing, meat packaging, casinos had a required temperature screening to go along with the health screening. Still have to do that health screening questionnaire for everybody, but we moved the temperature screenings to if possible. If you are doing those, I would encourage you to just continue doing those. They are a good tool to help identify those that are trying to get into the workplace and either may not know or, people respond different to fevers. So, keep doing it. We're not saying it's not important, but for something to be in place for the next 6 months, we thought that might be a little onerous. We created a rule in 5.8 of the emergency rules that the employer shall create a policy prohibiting in-person work for employees to the extent that the activities can feasibly be completed remotely. Obviously, we're getting a lot of questions on what that means. We know that the executive order said anything capable of being performed remotely shall be performed remotely, or if you're in region 6 and 8, should be performed remotely. So what MIOSHA will be looking for here is that just that in a business, and it can be in your preparedness and response plan, but somewhere in there you have a policy on why people are at work and which job classifications need to be at work. They're not really going to get into a debate with you on why they're in or why they're out. Just want to recognize that you've put some thought into it. Not that you just said, hey, I like it because when everybody's here, so I want everybody here, but you've really put some thought into it. As I referenced earlier with those outbreaks in the workplace, congregation is not good when we're trying to contain COVID. So certainly seeing them in those office environments is something we should be able to control more. In those manufacturing construction workplaces, with the community numbers the way that they are, we may see more of those. And I always want to remind everybody that an outbreak does not mean an error. So please engage with MIOSHA, engage with public health and others. If you have an outbreak in your workplace, that does not mean that you missed something or something went haywire. And we want to help get to the root of that problem and help identify other tools that might be available to make sure that we're doing the things that we can do. And the record keeping requirement, we've gotten a lot of questions on. We didn't see this as a change because this is what MIOSHA has been requiring from the beginning. I know there was some confusion because the executive order didn't say it specifically, and perhaps we weren't visual enough with what we were doing, but employers need to maintain records, and for employees and contractors coming in, for visitors, it's going to be that protocol, and we should have some public-facing FAQs, hopefully up to date. We've been working them through, and these questions have been coming in from a lot of different areas. So we're really working hard to get those up there. And then maintaining those records for a year. Now, when you're doing the daily health screening, all you need is a log of who took it and a pass-fail, date, time, that kind of stuff. You don't need the forms if you're using those. You don't need the answers to the questions that they had, just the pass-fail. And the reason for that is, the reason for that is that as you know, if MIOSHA gets a complaint, they have a legal obligation to investigate that complaint, and they're going to ask you for this information. And in the unfortunate event that there's a fatality, they're going to need to look back on what happened when that potential exposure may have happened. Doesn't mean they'll find it in the workplace, but they do have an obligation to investigate. So as you know, if somebody were to contract COVID, it could be sometime, if they unfortunately pass away, that could be sometime down the road, and they're going to need to check those things to make sure everything was in compliance. And so that's why these things are laid out the way that they are. All of the materials on our Michigan.gov COVID workplace safety site have been updated to reflect the emergency rules versus the executive orders. I'm sure that you'll find a couple of our pieces that might still have references in the wrong place, but what you're going to see there is a lot of consistency. There are not major changes that you need to make to the things that you were doing prior to these emergency rules. And that was our goal, is really to recognize the things that are necessary and make sure there was consistency. So you won't see too many things that you'll need to shift on, but all of these guidelines have been updated. We're working through some of the posters and videos now, so you might see a couple spots there that we're still working on, but it's there for you, and take advantage of it. I always remind, don't forget about the MIOSHA hotline out there. It's the 855-SAFE-C19. MIOSHA set this up probably in May for employers and employees to call in with any COVID workplace safety questions. It's a great tool. I keep reminding everybody, the wait time on this thing last week was 12 seconds. You cannot get that kind of service anywhere. So make sure you're taking advantage of this. It goes right into the MIOSHA experts. If you need more help than they can handle on the phone, they will get you over to the consultation team. MIOSHA, as you all should know, has a great consultation team. You can continue to request consultations. They can do those on the phone. They can come in person. Make sure you're taking advantage of this hotline, though, to ensure that, any of those questions that come up, just call and ask, and they'll work through them with you. Now, not as much in the manufacturing space, and there's a reason for that, but we launched an ambassador program that is a proactive consultation team that's going to go pop in certain types of businesses across the state, focusing in on those that are more open to the public for a couple of reasons. One is to really help mitigate the spread by ensuring those workplaces are putting in the pieces that they need. We don't really have this focused on manufacturing and construction because you typically have secure work sites and the processes are a lot different. So we would encourage you to go and request a consultation from the MIOSHA consultation team. Both the ambassador program and the MIOSHA consultations are not citation oriented, so they're not going to be there to issue penalties. They're going to be there to work with you to enhance and make sure that you're doing the things that you can do. And there is a sort of firewall between consultation and the enforcement side of MIOSHA. So their information doesn't go over there. So make sure you're taking advantage of those tools if you need some support and help in your workplaces. On our COVID workplace site, we have wonderful links to a lot of different places, but the MEDC Peer Michigan Business Connect platform, that's this long string of letters that is pretty funny. If you're a manufacturer making barriers, hand sanitizer, face coverings, and those, you can connect your business through there. If you need those things, MEDC, Michigan Economic Development Corp, has put together a great list of a couple thousand manufacturers in Michigan that are making those things. So make sure you take advantage of that resource. And then for those daily health screenings, you can use the My Symptom app. A lot of vendors are out there and some associations have created their own. We don't have a prescribed one from MIOSHA that you have to use. This one was created by DHHS and the University of Michigan. It's free to use. As an employer, you set up an account. You'll get a unique employer identification number that you give to your employees, and then they can do the health screening linked to you from their tablet, smartphone, desktop, you name it. And that you can get a real-time dashboard, or you can get flagged if somebody flags for symptoms, or if you're just using a log and check and pass or fail, the employee can show you their smartphone. They'll get a green if they haven't flagged. They'll get an orange if they have flagged for COVID symptoms. And those symptoms are being updated by DHHS, Michigan DHHS. So it's going to be a great resource going forward. And again, that's free if you don't have another tool that you're using. No prescribed method of doing that, but just make sure that you are doing the daily health screenings. And then from the Safe Start site, you can see a list of what's open, what's not, any restrictions that are out there, as well as what's happening in the state. And there are great resources from DHHS at the Mask Up Michigan campaign to help if you need some of those posters and other things. And then we're working toward Operation Hibernation, we've been calling it, but as we get into the fall, all of you have been indoors in your workplaces, certainly in your offices and in those production areas, want to focus in on some of those things in the air. Now, we have been talking about aerosols for months in different types of workplaces. There are no requirements for this other than certain industries making sure that your ventilation is working properly. Part of the reason for that is that systems are very unique, and trying to prescribe a specific method is hard, but we partnered with ASHRAE to really kind of run through. And ASHRAE, if you don't know, is the American Society for Heating, Refrigeration, and Air Conditioning Engineers. These folks write standards, they write best practices, they work across the industry, so they're really a great resource. They have some COVID-specific resources that talk about things that you might be able to do. We have done a 4-part series with them. 2 are already completed. I forgot to change the date again, Dave. The next 2 are October 22nd and October 29th is the final one. I got to change this slide. We tried to push that up so we could get through them. We've covered general last week, or last one we did, we covered ventilation specifically. Next one, we're doing filtration and then humidification. Ventilation, filtration, and humidification are some of the key concepts to focus on when we're trying to think about how to get that virus out of there, make sure the air is moving, try not to blow across people. And then humidification, as that goes down, it creates an environment where the virus can hang around longer. So that's just something we want to share. And then we have great information from our friends at Michigan Saves, who work with the Michigan Public Service Commission on things that you can do in kind of a range of costs. And then for the next 2, we have DTE and Consumers Energy joining us to talk about how some of these changes tie in with different types of incentives or rebate programs that they're doing. So just something to consider depending on your space, certainly in those office spaces. You know, if you have, if you're getting people back in the office, something you want to think about, more geared towards those general public spaces that we can't really control who's coming in as well, but definitely something to take a look at for sure. We have some links to other resources, but if you check out ASHRAE or Detroit ASHRAE or ASHRAE West Michigan, they do have links to COVID-related information on your buildings. Now, most of you have been open, but another piece that we haven't been covering, but that you'll want to consider is if you've had areas of your building closed, you want to think about the water and getting that moving again, because that is a big consideration too as buildings come back online for sure. So with that, hopefully I wasn't too quick, but to move into the Q&A period.
Well, thank you so much, Sean. Definitely appreciate that. There was a lot of information there, and I may have a couple questions just to kind of revisit some of the things that you've said. Let me start with a question that we've been getting a lot of calls about, a lot of emails about, and that deals with the record keeping rule. So in a situation where you may have multiple employers in the same building, how would visitors be treated in that situation? Or if a customer comes in or a contractor comes in into the building, do all the employees, or excuse me, all the employers in that building have to create a record, do the survey, or is it just whoever the employer who is directly impacted? How's that handled?
Yeah, I think so. That raises a few points and probably a couple of questions back to where that question has come from. So certainly if you're multiple employers in the same building and you have a common desk that, you know, maybe security or whomever, it would seem like you'd have that right there, right? That it could be done and you'd keep that record just with the main desk. If you don't have that, more than likely it's just whoever I'm going to visit. So if I can just walk in and pick a door, those other 2 employers aren't necessarily going to have to do any kind of screening or record keeping, because I'm going to walk in the door I need to be in. And then we are working through this question, and specifically with MIOSHA right now, but the intention is that the record keeping for pass, fail, date they arrived, and that kind of stuff would be focused in on those employees and direct contractors of that employer that are coming in. And then on visitors, it's more around making sure that you have a protocol, because part of the theory there is that if they don't pass the screening, they're not coming in at all, right? And they're not necessarily going to be exposed to other workers. And then I would point out, not so much for your members, but maybe in the healthcare sector, there are some other requirements specifically for outpatient care where they do need to be tracking their patients as well. But those are pretty specific to that industry, so don't stress on it too much. But we'll work to have a more specific and clear answer on that type of question, Dave, and I appreciate it.
No, thank you, and appreciate the work that MIOSHA is doing to put together an FAQ that we can share with folks and folks can turn to. One of the questions we got from our membership deals with face coverings. Question says, does a face covering need to be worn for in-person meetings if social distancing, 6 feet or more, can be maintained? Face coverings are not required when sitting in open cubicles if social distancing is maintained. Isn't this the same as an in-person meeting?
Actually, there are quite a few differences there, and you'll also see this in our FAQ because it's come in. But anywhere in an office setting, any workplace setting, that you need to wear a face covering when you're in those quote-unquote common areas, which would include hallways, restrooms, break rooms, anywhere and those in-person meetings. The difference between a cubicle is, in theory, right, you're going to be surrounded by walls. So even if that person's on the other side of the cubicle wall from you, there's a barrier between you two. So it's not the same as an in-person meeting where there are not going to be those barriers, and there's not necessarily going to be that separation. And now I know that employers have asked and they said, you know, well, I can have a meeting and I can have everybody spaced out, but just for now, you need to wear those face coverings in those in-person meetings. And that couples with, you know, I mentioned it briefly, but you do need, as an employer, to be looking at those DHHS orders as well. And because it does say that as well for businesses and workplaces, that, and we would probably see that more fluid changes with the orders that they've put out, but in-person meeting is going to be a common area, and you'll be needing to wear those face coverings. Okay.
Kind of touching on something you mentioned in that answer, referring to DHHS, you know, for those employers that have locations in more than one local jurisdiction, are you aware of anything that's either in the rules or in the statute that allows MIOSHA to do something to prevent a patchwork approach to the promulgation of rules? Anything that DHS is doing to kind of avoid that patchwork? What advice would you have for members who are in more than one local jurisdiction?
You know, that's a great question, Dave. And I think after the Supreme Court decisions, I know that the following week we saw several local health departments kind of doing their own orders to try to fill that gap, so to speak. But within the MIOSHA space specifically, MIOSHA can issue rules based on its statutory authority, which covers the vast majority, all but a few limited exceptions, of workplaces in Michigan. However, under the epidemic authority that DHHS is using, they're going to have some pretty broad latitude to implement orders or requirements that are believed to enhance their ability to contain the virus. So I think we'll have to watch for that. My understanding is that many of the local public health departments started pulling back their orders when DHHS issued theirs. So what you'll see in DHHS is some overarching requirements on face coverings, gathering sizes, those seating capacity limits in certain types of establishments. What you'll see in MIOSHA is a more focus on that employee-employer relationship and some of the things that employers need to do. So to answer your question, no, I'm not aware if MIOSHA has any statutory authority to say, hey, we have this and you can't do it here. I think, but everybody is, will operate under the umbrella that they can.
Right.
We have been, to your point though, we have been coordinating with DHHS on the pieces that we believe we have covered and the pieces that we believe we don't have authority to do. So they're definitely aware of where we think our space is, and that should be reflected in the rules versus the DHHS order.
Okay. Is there a one-stop shop website or anything that folks can go to see what the latest MIOSHA rules are, the DHHS rules are, and what maybe the local rules are?
Yeah, I think the hardest one there is probably the local rules, just because we don't necessarily always know, at least in our space, if they're doing something different. But if you go to michigan.gov COVID workplace safety, we've been saying that one a million times since the beginning. All of the guidelines and everything there posted are created by MIOSHA. We do have links over to the DHHS order as well as the infographics. We have a great infographic as well, and they do as well for the order that they put out and kind of the overarching things that covers. Those are all linked right there, and I would definitely check that out for sure. Our COVID workplace safety site is where we put everything. So if anything changes and we're updating anything, that's where you're going to find it. So definitely check out that site for sure. And then certainly I see Mike now and Dave are on calls with me at least once a week, and they can call me anytime they want. So they're definitely in tune with anything that we might be doing for sure, to make sure that they get it out to all of you.
Here's a question that I guess really touches on our familiarity with the Administrative Rules Act. So folks are asking, well, how long do the emergency rules last? Can they be extended? Is there anything that the legislature is working with MIOSHA on to put something in statute so that the order is no longer necessary because it's in the statute or what have you?
So a big legal question there, huh? Yeah. So the Administrative Procedures Act allows us to issue emergency rules for up to 6 months, and that's our emergency rules will go into April, 6 months from October 14th. Under the law, if necessary, we could extend those an additional 6 months. So that would get us, toward the end of next year. And then at that time, we would need to engage in the regular rulemaking process to, make those permanent, should that be necessary. I think that we've been asked if we're going to engage sooner on the rulemaking process. I think, honestly, I think we want to give it some time to see which direction COVID goes, things we might need to be doing or otherwise. So as we start to close in on that April timeframe, early next year, and we have a good idea what's happening, where vaccines are, how COVID's trending, I think we'll want to definitely engage at that time on more of the discussion for sure.
Great. Another question's come in, deals with the record-keeping requirements again. The question reads, Section 11 contains some record-keeping requirements that are a little unclear. Specifically, we're wondering whether the requirement to maintain a record of screening for each employee or visitor entering the workplace mandates that we keep documentation of individualized screening results for each person, or just a record that screening was performed for X number of people at the facility each day, or something in between. The concern is data privacy related to these screening records if they are specific to screening results for individual entrants.
So MIOSHA's take on this right now is that for employees and contractors specifically, you'll need to keep a record of the pass-fail. You don't need the individual answers or anything like that, but the pass-fail point of getting past the screening. MIOSHA's looked into their rules on medical records and things like that, and they've identified that none of these meet, the questionnaire itself does not meet the definition of a medical record. So, but all they're really looking for is that pass-fail.
Okay. Next question deals with food processors. We are a food processor considered essential under CDC guidelines. Under their interim guidance for implementing safety practices for critical workers who may have had exposure to a person with suspected or confirmed COVID-19, we are allowed to have workers who have had an exposure but remain asymptomatic to continue to report to work, providing they wear a mask at all times, practice social distancing, etc. Are we still able to follow those guidelines, or do the MIOSHA and MDHHS guidelines for quarantine trump that?
That is a wonderful question that I'm going to have to take back and try to work on. I think it's an interesting topic. My understanding of CDC guidelines is that they really only allow certain healthcare workers when there's a shortage to continue potentially working in certain ways if they have tested positive or asymptomatic or something like that. So I have to do a little more research. It's not something that's come up with us in MIOSHA at this point, so I will get back to you guys.
Okay. And I think you can be assured that between Mike and myself, we'll probably follow up with you on that as well. Another question we had, we've been conducting the temperature checks since May. We are getting into our cold months and are seeing a lot of low temps with the thermal guns. Any suggestions? Not sure if we're really seeing value with those temperatures.
So that's one of those spots where I think as an employer, you can make an individual determination now if that continues to make sense for you, because as I mentioned, that's moved from manufacturers have to do a temperature screen to an if possible. And the way that MIOSHA is looking at that if possible is, does it make sense for you to be doing it? So we know that if you're doing that outdoors before people come in and you're trying to use that thermal scan, maybe in the winter it doesn't make much sense. Maybe one of the things is that it creates crowding, and certainly we don't want that, where people are suddenly within 6 feet of each other now because everybody's stopping to get a scan. So like I mentioned, I'd encourage you to continue at least considering it and doing it if it makes sense in your place of work. But if you're having these issues, just reevaluate and try to determine if it makes sense to continue.
Very cool. Another question we've received deals with COVID coordinators. Does a COVID coordinator need to be present in an office setting if there's only one person working at the office?
It seems like you found your COVID coordinator in that question, right? So if there's only one person working there, we have similar situations in the state of Michigan where we're reporting to a supervisor. I know that the rule says that they need to be there all day. Certainly for that day that they're in there, you can call them the coordinator. There's no, it doesn't need to be management. It doesn't need to be, a particular person all the time. You can have a different coordinator for different days depending on how you operate. Certainly consistency is good. So if you can make somebody the coordinator and keep it that way, that's always helpful. But things change, you got to move, and certainly just being flexible with that will work.
Okay. Another question we have goes back to healthcare screening. It reads, our manufacturing facility has all employees, contractors, and visitors complete a healthcare screening questionnaire once for the first time entering the facility, and if anything changes in their health or travel, etc., they would complete it again. However, everyone's temperature is taken daily, and the temperature reading is documented. If the individual reads high, that person is not allowed to enter the facility. Does this meet the intent of the daily healthcare screening rule?
So not knowing the specifics of, I think if that person wants to get more detailed, I would encourage them to call consultation. I would be reluctant to answer that question generally because everybody's practice might be a little bit different, and I don't want to lead anybody astray. But that daily health screening is certainly the questionnaire. You have to have the questionnaire, and depending on how you're doing that, you should be good. But and then the temperature screening component, certainly now we mentioned the if possible part. If you can continue to do that, that's going to be one of the flags. So still on that pass fail. You don't necessarily have to write 100.5. It's a pass fail. But definitely call consultation or 855-SAFE-C19 and talk through what you're doing.
Thank you. Got a question on the categorizing of tasks and procedures. The question reads, Rule 3 deals with the categorization of tasks and procedures. Most of manufacturing activities fall in the low and medium categories. What should the employers do with this information? Do we have to write it down in a policy manual or somewhere that can be seen?
Yes, that categorization of workers should be in your preparedness and response plan. It can be right at your outset. You can list classifications and check medium, low, medium, low. Many manufacturers during community spread like we have are probably going to fall in that medium space just because, again, you have people coming together in a space, so you're going to be thinking about those face coverings and all that kind of stuff. Some will be low, of course, but yes, just include that in your preparedness and response plan that you've made that evaluation. It really has to do with the face coverings, barriers, PPE, how you're sanitizing and all that kind of stuff, just based on the possibility of exposures.
Okay. Question next from the audience. Would an employee badging in after receiving a temperature testing that they pass and answering the question, does that count as a record, and must that be kept for the entire year? Just they're scanning in and out.
Yeah, potentially, but the scanning in and out wouldn't tell us if they passed or failed, right? So that becomes more of like a signposting requirement that says, don't come in here, don't scan in if you don't feel good. So that is not really going to tell us that, you know, I was off work because I had symptoms. It's just going to tell us I was off work. And I think from a MIOSHA perspective, you'd want to think about how you can get that pass-fail component into your record keeping for employees and contractors.
Okay, great. We've got a couple questions left, and if there were any questions that we didn't get a chance to get to, please, by all means, feel free to send them in, and between Mike and the rest of the team, we'll get you an answer. The question wanted to kind of revisit the webinar dates for the Operation Hibernation. Just again, making sure that we got the correct dates there. So again, you said they were the 22nd, the 29th, or something along those lines?
Yep, it's October 22nd and 29th. Both will be from 2:30 to 3:30. ASHRAE will do about a half hour or so on those specific topics now, on things you can do with filtration and humidification. Our previous ones are posted. If you just go to our Department of Labor YouTube page, you can find them there. If you do want to watch those and check them out. The previous dealt with ventilation, and then the first one was overall on all components. They have some great visuals that will really help you on air changes per hour, what humidity does with the potential spread of a virus and all that kind of stuff. It's really, really helpful. They are quite long, but you know, it's heavy information. And then for these remaining two, as I mentioned, we'll have me for just a couple minutes, ASHRAE, and DTE and consumers to talk about those incentives, rebates, and other things that can tie into these changes.
Great. The last question we have from the audience is about your PowerPoint presentation. Just wants to know if we can get access to that and be able to click on those links that you talked about in the presentation.
Sure thing. I will work with our folks to get it over to you, Dave and Mike, and you can share it out from there.
Fantastic. Appreciate that. And Sean, I just really want to thank you for your time and the work that you're doing and making sure that we have a great line of communication between your team and ours. It's been a very beneficial relationship, and we're very happy to share information that we get from our members, and glad to share the information that you share with us to our members, and to do the best that we can to keep building that relationship. So thank you so much for joining us this morning.
Yeah, thanks for having me. Really appreciate it.
Yeah. And before we wrap things up, just a quick reminder to those MMA members who are on the call, don't forget that tomorrow at 1:30, we have another webinar. This one covers the 2020 election. It's going to be hosted by Mike Johnston, and it features Kyle Meehlin, the editor and vice president of Mears News Service, and Zach Gorchow, the executive editor and publisher of Gongware News Service. So make sure you check that out, register if you have not done so already. And then looking at next week, we have a webinar dealing with the application process for Going Pro, for the Going Pro Talent Fund. And that I think will be very informative and very timely as the applications for Going Pro open on November the 2nd. And will be turned around real quick. You only have about 28 days to get those applications in, because they will close at the end of November. For more information about those, feel free to go to the website or drop anyone here at the MMA a line. With big thanks to Dane Cook and Delaney McKinney behind the scenes who were producing the webinar, and a shout out to Mike Johnson, who is making sure I'm doing a good job. I've been Dave Worthams. Thanks for joining us this morning. Go Blue, go Broncos.
Nice job.